As a part of my job, I really love that I get to treat these patients over their lifespan of their disease, which for these chronic conditions tend to be many years. I'm with them in the trenches, trying to improve their quality of life every day. My chief role here is to really grow the program to offer more subspecialty care for our patients and to create a more cohesive, comprehensive care model in this region to help navigate your care in a more efficient, comprehensive way. As a movement disorder specialist, I see mostly patients who have different types of abnormal movements, like Parkinson's disease patients, or people who have tremors, like essential tremors, those who have Huntington's disease, ataxia, dystonia, which kind of like abnormal muscle contractions, any of those types of movement problems. In movement disorders, we treat a lot of complex issues like Parkinson's disease, which has really progressed in a good way over time, being able to offer more therapeutics, more medications, more different types of procedures to treat these symptoms and the different diseases. And that's why my subspecialty exists, because we can offer and keep up to date with all these different modalities to really improve the quality of life of these patients over time. So technology has played a major role in the improvement of quality of life for these types of patients. And one of those technologies that really exemplifies this is the MRI-guided focused ultrasound treatment, which is approved to treat Parkinson's disease patients and essential tremor patients. And we're working to bring it to MedStar Health. Currently, I'm the only neurologist in the country who is trained to do this procedure without neurosurgery intervention. MRI-guided focused ultrasound is a way to treat these symptoms in a non-invasive way that does not involve cutting or drilling. It's an outpatient procedure, and so you come in with these symptoms of these diseases and you go home with them being dramatically improved. The American Academy of Neurology is one of the premier organizations representing neurology care throughout the United States. And every year I've been involved in one of their subcommittees working on current guidelines, quality measures, really up-to-date improvements in the field of neurology. And with my involvement in the American Academy of Neurology, I've been able to be involved in a lot of their up-to-date projects and guidelines, and the most recent guideline associated with the treatment of Parkinson's disease, which came out in 2021, I was one of the authors because of my involvement with this organization. MedStar is the largest health system in Maryland, and one of their growing pillars is neurosciences. And so they have definitely invested a lot of resources and personnel to improving neurology care throughout the state, and including in the Baltimore region. And so the fact that we have that to tap into, the great specialists that we have here and the great resources to really provide a comprehensive care to improve your quality of life is ultimately, I think, what brings us apart from the rest.